Many thanks for choosing us. Some selected health facilities in the Ashanti region have begun administering Johnson Johnson COVID-19 vaccines to persons above 18 years. Though the exercise suffered delays, the early stages takeoff has since been smooth. Taking part in the exercise are 4 districts driving COVID-19 cases in Ashanti, Oforikrom, Kwadaso, and Asokwa municipalities, as well as a Kumasi Metro. The Menchia and Centresa government hospitals, Children's Hospital, and KMA Clinic in the Kumasi Metro have all started without hitches. At least 150 people have been vaccinated at the Centresa Government Hospital Center in the Bantaba Sub-Metro, where 8,000 people are expected to be vaccinated during a visit by a news team at about 2 p.m. Ohementeria earlier interacted with some people who had turned up for the vaccination.
How long have you been here?
About 30 minutes. Wow. Yeah. I came here about 12 p.m. It is almost 1. Now that you are getting ready to take the vaccine here.
So when you came, did you meet other people who are already here, or you were the first person to arrive?
No, I am number 22. Some are here since morning after they hear the news that today, 13th, the vaccine was started and end 18th. So they decided to come to here in the morning to take the vaccine, but it's yet to come. Yeah.
So what has the health officials been telling you as far as this vaccine delay is concerned?
They told us the vaccine is ready in Kumasi, but it is in the regional office. So they went there to share it. So this is the time that they have got their share to start the vaccine.
How does it feel to have the first shot of your life as far as your protection against COVID-19 is concerned?
Well, the whole world has come to realize that COVID-19 is a very, deadly disease that we've all been confronted with. So it feels good that I've been the very first person to take my shot of the Johnson Johnson vaccine here at the Menchia Government Hospital. It's okay. It feels okay.
Is it that painful?
It's okay. It's okay. It's just like the normal injection you take, anywhere you go when you're confronted with any disease. It feels very normal. It feels very normal.
Okay. So what's your name, sir?
ASP Faisal Ibrahim.
All right. So that is ASP Ibrahim is the first person to receive the dose here at the Menchia Government Hospital Vaccination Center, and he says, yes, it feels normal.
Ohementeria interacted with public health nurse at Menchia Hospital on the entire process. Persons talking about the process and says it's been very smooth.
Starting today for the 3rd phase of the COVID vaccine. And for 1 or 2 challenges, we are yet to start over here. Training has already gone on. We've done our training, and in a few minutes' time, we are starting at Menchia Government Hospital.
Is it not surprising to say that though the exercise is yet to start, but we have people who are anxiously waiting in the queue to be served?
Yes, it is. It tells how people want the vaccine. They want to be vaccinated because of the nature of the COVID virus and how it's been changing itself. Nobody can tell for now what will happen in future. And so for now, I think everyone wants to be vaccinated. And so with a little information that we have vaccines, people are rushing to be vaccinated. Even before the vaccine came in, people were calling to ask when the next batch will be in. So people are anxiously waiting for them to be vaccinated.
Yeah, you talk about some challenges that you faced. What are some of these challenges that you mentioned?
Yeah, after vaccination, records has to be taken, and we have tablets that your information has to go on. So far, those that we vaccinated, we have all their information on our tablets, so it can be viewed worldwide. Yeah, so that takes a lot of time, and for the tablets to be ready for us to be able to even queue in the information takes some time. We have to do some logging in, password and all that. And so that has delayed a bit. And we will soon be able to start.
In some of the centers that I visited, there were concerns with the fact that the vaccines arrived late from Accra. Did you have a similar experience here?
Yes, it's the same everywhere. But I will not say it arrived late. It was supposed to arrive today, and it did arrive early in the morning. It was in Kumasi. But the plan is that we are supposed to start as soon as the vaccine arrives. And so even if it arrives in the afternoon, we are supposed to start that afternoon. Yes, so we were supposed to get ready, and as soon as the vaccine arrives, we kickstart. So that is the plan. So I wouldn't really say that it has delayed. The first 2 vaccines that we've used, it requires you coming for first dose and a second dose. But the Johnson & Johnson is just 1 shot. So after you've received your injection, you don't come again for another injection.
What is the requirement for somebody to take part in this vaccination exercise?
The requirements is 1, you shouldn't have received a first dose of the previous vaccine and come here for the second dose. And then when you are coming, you should come with a valid ID card, preferably the voter ID card, your passport, with accurate information to give, so that in case you are traveling and it is required of you to tender your vaccination card, the information given will be the same as the document that you are traveling with.
But do you have enough doses to serve the public?
You see, we are vaccinating in phases because we don't have enough at a time. So that is why we did the first one, did the second phase, and now we are on the 3rd phase. So I wouldn't say it's enough for the whole public, but at least we will reach somewhere. We have enough. For Menchia Sub-Metro, we are expecting 8,500 people to be vaccinated. Yes.
And then how would you ensure that among people who have queued and receiving the shots from Johnson & Johnson are not the same people who participated in the second and the first phase of the exercise?
Yeah, so before we will start, we give them that information that if you know that you've already received a shot, you are not part of this exercise. And then before we also give you the injection, we also check on our app to see if we have your information on the app to show that you've received some before we also proceed to give you this injection. So that is the check that we are using to rule out those who have received the vaccine before.
Is there any contraindication, side effect for somebody to receive this dose and then that of the AstraZeneca or Sputnik 4V vaccine?
For side effects, we cannot say for sure. For someone who has already received the AstraZeneca and coming for the Johnson & Johnson, studies have not shown the reaction that would crop up. The main reason we are cautioning the public that if you've already received the Covishield, which is the AstraZeneca, or the Sputnik, please do not come here for the Johnson & Johnson, because we are not sure the reaction that would come up.
Medical Superintendent Dr. Ejakun Opoku tells the Ministry of Our Health that some people who received the first jab of AstraZeneca vaccines wanted to participate in today's exercise were turned away. According to him, the health personnel took time to explain to those who have had the first jab of the AstraZeneca vaccine to desist from taking a Johnson & Johnson vaccine.
We were made aware. It has been smooth so far. As you can see, we don't have the heckles that we had during the first vaccination exercise. Perhaps people have not heard about it, and we do hope that tomorrow people rushing in here. Reason all things in order, making sure we have our canopies because of the rain. We also have chairs around. We'll cater for the people with disability and the aged. They will have their own. This exercise is supposed to cover people from 18 years and above, unlike the previous one when we were targeting a specific group. So all persons 18 years and above can come for their vaccine. It is open to all, and it is one jab. You just take one injection, and that's all. You don't come for the second one. There's nothing like the second. It's all in one. It's one menu. Once you take it, you take it. Except for pregnant women who may not qualify for this vaccine at this time, they will be catered for. We have not had any difficulty since we started this morning. People have comported themselves, except that few people who came thinking that it's their second jab were disappointed. But we explained to them that this is a different vaccine altogether, and it is not possible they can have it, so they should wait. We are happy this morning, but we have some staff who have not been vaccinated. We've got the opportunity to vaccinate them, and we are waiting for people to come to have it. Here, Bantama Sub-Metro, we cover Bantama Sub-Metro, and we are expected to cover about 8,000 persons. We have 3 static points. We have at Atasemanso Hospital, so we cover, it's like at Atasemanso, Bushine, and then around Santasa roundabout. They can come. Despite this, if you live in Kumasi and you can come here, you'll be accepted.
All right, so the vaccination in Kumasi has been smooth so far. We'll try and reach Ohiminteria of our health desk. He's been monitoring the facilities that are administering the doses. But of course, if you're in the Ashanti region, you know that you can go to the health directorates. You can go to the Kumasi Metro. That's where you can get your Johnson & Johnson vaccination. You can go to Maternal and Child Health Hospital, the KMA Clinic, the Menshia Hospital, and you can also go to Sepe Aprampram Health Center. You can go to Moshi Zongo Hospital, and then you can also go to Materdale Hospital and Sontreso Government Hospital, and also the County Hospital. These are the sites where the doses are being administered in Kumasi, the Ashanti region. My colleague Ohiminteria has joined me now for more. Ohiminteria, the day is almost ended. What can you say about the vaccination exercise? How has it been so far at the places that you've visited?
Thank you, Aisha. I must say the exercise is still ongoing at the facilities selected to participate in this exercise. We are told by health officials that 4 districts in the Ashanti region, which are noted for increasing COVID-19 cases, are the ones participating and will be benefit from this exercise. Talking about Kumasi Metro, we have Asokwa, Kwadaso, and then Oforikro municipalities. In all, each of the districts is expected to vaccinate not less than 8,000 people. So the health officials believe very well that though the exercise started on a very slow note, but they expect high numbers tomorrow. They expect many people to besiege these centers to be vaccinated. At the Sontreso Government Hospital, for instance, that is the only point, or that is the only facility which has recorded the highest number of people being vaccinated. As at the time I was leaving the facility at 2 p.m., 150 people have been vaccinated so far. And the medical superintendent, Dr. Ajakupoku, said they expect more people to be vaccinated from tomorrow. Unlike the other places which the exercise delayed, the Sontreso Government Hospital started at exactly 9 a.m. So you can imagine the number of people who have been vaccinated at this facility compared to areas like Menshia Government Hospital, where the exercise started at after 12 p.m. today. But the other area of concern is the fact that people who have already received their first jab of AstraZeneca in the Ashanti region visit some of these facilities, especially at the Suntreso Government Hospital, to receive their second dose. But health authorities wouldn't allow these people to have their way. Dr. Jakopoku says it took them time to speak to these people who benefited from the first and second phase of the exercise, for them to understand that, yes, this is not a situation for them to come and also participate and receive a second dose. So they should wait till authorities announce another date for them to also receive their second jab. So these are some of the few challenges that have been, happening or been happening in these facilities where the exercise is ongoing, Aisha.
The vaccination exercise, when it started, I mean, we experienced a lot of vaccine hesitancy. In the Ashanti region, it also happened. What can you say now? Are people willing to take the jabs?
I would say yes, people are willing to take the jab. People now understand the deadly nature of COVID-19. So people want to protect themselves against COVID-19. And that is why in all these areas that I mentioned, for instance, at the Menchia Government Hospital, when we visited the facility, even though the health personnel were, in a meeting, they were undergoing training to be able to work efficiently. There were people who had gathered and they were in a queue waiting to be vaccinated. Some of the people I spoke to, some of them had been there as early as 9 a.m. Waiting for about 3 hours before even the exercise kick-started. So yes, residents of the Kumasi and the Ashanti region are prepared to be vaccinated, unlike the earlier first and second phase of the exercise, where there were some sort of disagreement, some sort of apathy among people. And even then, there were discussion among people that, the vaccine wasn't, there were a lot of reasons that people gave as far as the vaccine was concerned. But now people are free to go out and then to receive their first jab, especially some of them that I spoke to tell me because of the deadly consequences of COVID-19, they want to avoid this. And in order to avoid this, the best way is to receive the vaccine, which of course comes at no cost to them.
Ohiminteria is our man in the Ashanti region. So how long is this going to happen in the Ashanti region? Do you know, Ohiming?
Hello, Aisha.
I'm asking how long this will happen in the Ashanti region. How long is the exercise?
Yes, according to the health officials, the exercise, which started today, will end on the 18th of this month. So we have about 5 days for residents in the Ashanti region to go for the vaccine. So yes, every day between now and 18th of this month will be the day for the exercise.
Ohiminteria is our man in the Ashanti region monitoring the exercise for us. The Greater Accra Regional Health Directorate will also from Monday, 16th August, begin the next phase of vaccination in the region. The exercise is expected to end on 20th August 2021. According to Regional Director of Health, Dr. Charity Sapong, the health service will be using the single-dose Johnson & Johnson vaccine for this phase of vaccination, which will be limited to 7 districts in the region that have been described as hotspots. The Directorate expects to vaccinate 100,000 people at the end of the exercise.
We are starting the Johnson & Johnson vaccination. We are starting it fully from Monday, which is 16th August through to 20th August. I'm sure we're all aware when the government announced that we had received the Johnson & Johnson vaccines into the country. And as for the Greater Accra region, we are going to be able to ensure that at least 100,000 people are vaccinated with this Johnson & Johnson vaccine. For this vaccination exercise, we are concentrating on the hotspots within the Greater Accra region, where the new cases, they are recording lots of more new cases as compared to the other districts. This doesn't mean that the other districts are not recording cases. They are, and I'm sure with time, as we continue with the vaccination, everybody is going to get vaccinated and protected against this COVID-19 disease. So for this Johnson & Johnson vaccine, which we are starting fully on Monday, the districts where we are concentrating on for this is going to be, like I said, the hotspots, districts that have been identified with this new upsurge that we are seeing in cases. And these districts are mainly Accra Metro, Tema Metro, Okaikwe North, Ablekuma Central, Katamanso, and then also we have Adenta and Ga South. These are the districts that we are concentrating on for this Johnson & Johnson vaccine.
Meanwhile, the director says they will prioritize the aged and people with other comorbidities. Regional Director of Health, Dr. Charity Sapon, again.
The eligible people who live there and have not been vaccinated, either with the AstraZeneca vaccine or with the Sputnik V vaccine that we did. So if you live in these districts that I've talked about, and you are 18 years and above, and you have not been vaccinated with either the AstraZeneca or Sputnik V, and you are 18 years and above, then you are eligible, with the exception of pregnant women. So anybody, individuals 18 years and above, they are all eligible, and who have not received any vaccination, they are all eligible. As usual, of course, priority will be given to people, the aged, that is 60 years and above, and also individuals that have either other comorbidities, you know, the priority will be given to them. But then at the end of the day, everybody who is within 18 years and above is eligible, but you must be living in these districts that we have spoken about. And we are also hoping and entrusting that everybody who falls within the range will take advantage and ensure that they get vaccinated. In each of the districts that we have spoken about, from Monday, in all our district hospitals, it will be rolled out and people can go and take the vaccine. The only thing that we would like to stress is that when you are going, you must take an ID card that will identify who you are.
Let's now check updates of the country's situation as far as COVID-19 is concerned. The country's new cases now stand at 308. Confirmed cases, 109,736. Active cases now 6,440. And recoveries has been 102,390. The death toll is now 906. And you can see on that map there, the red circles indicating the hotspots in the country, led by the Greater Accra region, followed by the Ashanti region.